Every surgery will have an element of pain, but we will do our best to help you manage this. Before your surgery, your anaesthetist will explain whether you will have a spinal or general anaesthetic. After your operation, we'll look after your pain management while you're still in hospital. It's really important to have your pain medications regularly so you can participate in your rehabilitation. BMI staff will monitor this regularly, but don't be afraid to tell the nursing staff if you're in pain. Once you go home, you'll be in charge of your own medication, so make sure you listen carefully to your team when they explain it to you.
It is important to take your pain medication as prescribed and to take it regularly as clockwork, as we do not want you to be in pain. It is best if you take your pain medication before the pain starts or becomes severe. As with all medications, it is important to avoid alcohol and to not take any over-the-counter pain medication that may interact with the pain medication we have supplied. Should you need further supplies, please contact your GP. If you feel the pain medication is not working for you or you experience unpleasant side effects, then please contact the hospital, your GP or the pharmacy team. The pain medication we have given you may cause constipation. With this in mind, it is important to drink plenty of water. This is important for bowel function. You should drink at least 8 glasses of water a day and ensure that you have fibre in your diet, such as fruit and vegetables. If you are suffering from constipation, you may take over-the-counter laxatives.
If you do have any questions about the procedure, however big or small, be sure to ask your surgeon or another member of the BMI healthcare team. We're here to make you feel as comfortable and informed as possible.